The CDC says Nigeria, though, has been successful in containing the Ebola outbreak inside its borders. After the first reported case back in July, the country opened an Ebola operations centre to quickly respond to the outbreak. Well, for more on that apparent success, Dr. Faisal Shuaib joins us now from London. He is in charge of the Gates Foundation's Ebola Emergency Operations Centre in Nigeria. And thanks for being with us. First of all, how successful has Nigeria been and why?
Thank you, Michael. As of today, Nigeria recorded 19 confirmed cases of Ebola virus disease. There were 7 deaths and 12 discharges. Critical to the success that we recorded in Nigeria, 3 elements. Firstly, there was rapid action on the part of the federal government and the Lagos state government by first quickly declaring a public health emergency with the recording of the first case and mobilizing swiftly human, material, and financial resources required to contain the outbreak. There was also leadership provided by the Minister of Health, the Lagos State Governor, and the Project Director of the Centers for Disease Control in providing protected authority and the space for the Ebola Emergency Operations Center to actually contain the virus. And then thirdly, very critical to the success that we've witnessed in Nigeria is the establishment of the EOC.
Yeah, indeed. But, you know, when you look at that apparent success, you know, it makes me wonder how good or bad cooperation is between the affected countries. If Nigeria could achieve that success in limiting spread, are you able to export that sort of a system, if you like, to places like Sierra Leone?
Yeah, absolutely. Even as I speak, Sierra Leone and Liberia are already replicating the same model that we've used in Nigeria in terms of establishing emergency operation centers for Ebola, having partner agencies, international donor agencies like the World Health Organization, UNICEF, the US CDC, MSF, Médecins Sans Frontières, the Red Cross, and quite importantly, we've had sitting in the EOC and really supporting its establishment, the Gates Foundation and the Dangote Foundation, which is funded by Aliko Dangote, Africa's richest man.
Yeah, you know, I'm curious, you know, just being here in the United States and watching the extraordinary amount of coverage that is given to the US's first case of Ebola and only case of Ebola so far. I'm curious what those in Africa think of the reaction of the West when everybody seems to be very excited and worried about one case in the US, but there have been so many thousands of cases in Africa. Is there a sense in Africa that they've been pretty much left behind here, forgotten by the outside world?
No, on the contrary, there's a feeling of understanding because it starts with just one case. And if there's no comprehensive action to contain the outbreak, then you see thousands of cases. So people here in Africa understand clearly why rapid action and excitement and apprehension, as it were, is pervasive in the US. It is action that needs to be taken immediately to contain the virus and prevent it from spreading further.
All right, we will leave it there. Dr. Faisal Shuaib in London, thanks so much. Appreciate your time.